Still tired on B12? You might be taking it wrong. If you're a senior taking vitamin B12, but you still feel tired, foggy, or get tingling in your hands or feet, this video can save you months of confusion. Because the problem is often not, you need more B12. It's how you're taking it, and whether your body can absorb it. B12 equals nerves plus blood plus brain support. Vitamin B12 helps your body make healthy blood cells and supports your nervous system. And here's the part many people miss. B12 problems can show up as nerve symptoms even before anemia shows up. That means you can feel numbness or tingling and still have okay blood counts. So if you're over 60, you want to be smart about B12, not casual. Age can reduce stomach acid as we age. Many people produce less stomach acid, and stomach acid helps release B12 that's naturally attached to protein in foods like meat, fish, and dairy. That's why a key guideline for older adults is this. People over 50 should get most of their B12 from fortified foods or supplements, because that B12 is already in a free form and is easier to absorb. The 5 most common B12 mistakes. Seniors make mistake 1. I eat meat, so I'm fine. Eating animal foods helps, yes, but age-related, low stomach acid can still reduce how well you absorb food-bound B12. So I eat meat doesn't automatically mean I absorb B12 perfectly. Mistake 2. My multivitamin is enough. Many multivitamins contain small amounts of B12. B12 only. Supplements often contain much higher doses. So if someone has a real deficiency, a basic multivitamin may not be the right tool. Deficiency treatment should be guided by a clinician based on labs and symptoms. Mistake 3. Paying extra for methyl or special forms thinking it absorbs better. People argue online about the best form, but expert sources note there's no evidence that absorption rates differ by form in supplements. So don't get trapped by hype. Consistency and the right plan matters more. Mistake for thinking sublingual is automatically better. Another big one, sublingual tablets. Evidence suggests no difference in efficacy between oral and sublingual forms for most people. So if you prefer underthong, fine. But don't assume it's the only way or stronger. Mistake 5. Assuming shots are always required or never required. Shots can be important in certain conditions like pernicious anemia, where the body can't make intrinsic factor and has trouble absorbing B12. But for many people, studies show high-dose oral B12 can raise B12 levels, similarly to injections in the short term. So the truth is, it depends on the cause. The doctor-style action plan, simple steps seniors can follow. Step 1. Fix the source food versus fortified versus supplement. If you're over 50, don't rely on food alone. Use fortified foods or a supplement so the B12 is in a form that's easier to absorb. Step 2. Don't guess. Test smart. If you have symptoms like fatigue, numbness, tingling, balance issues, or memory changes, ask your clinician about testing. Serum B12 is commonly used. And if your B12 is borderline, clinicians can use methylmalonic acid, MMA, as a more sensitive marker to confirm deficiency. And remember, nerve symptoms can happen without anemia, so early action matters. Step 3. Watch the silent B12 lowers. Especially common in the US, some medications can lower B12 over time. Metformin has strong evidence for reducing B12 levels in some people, and diabetes guidelines recommend periodic assessment of B12 in long-term metformin use, especially if symptoms like anemia or neuropathy appear. Acid reducers like PPAs and H2 blockers may also be linked with lower B12 in long-term use, but evidence and recommendations are mixed. Some expert guidance says routine screening isn't necessary for everyone, but if you have symptoms or multiple risk factors, it's worth discussing with your clinician. If you're a senior, don't waste money guessing with B12. Save this video and share it with someone over 60. Follow at Corporal Health for science-based senior health tips. Educational only, not medical advice.